night, and this morning he flew down to Mbarara. So, Professor Matthew Bato, you're welcome.
Great. Good morning. Since I've been here, but I have a little assignment on probably 7 years, maybe a bit longer than that. Anyway, so this morning is just a bit of an update on effective cataract surgical coverage, ECSC, because this is becoming a really hot topic, important topic globally and nationally. And I hope by the end of this, if you're not familiar with ECSC, you will not ECSC by the end of and thinking together about what that means in our context, in the countries around the world. If you're interested to read a bit more about the background of this, I refer to something called the Lancet Commission on Global Eye Health. Can I just read that share? Is that possible to read that share? I think some people will miss some of the text. And you know that free of charge and more background about some of these matters. So, the global, in terms of blindness at the top there, has really one of the lowest rates, okay? And as a result, population prevalences of cataract are higher than elsewhere. Second indicator is cataract surgical outcome. This is sometimes referred as CSO, and this is a measure of effectiveness, and it's really a kind of a measure of how good the result is in terms of visual acuity. Previously good was considered to be 618 or better. WHO, as I'll come back to in a moment, has changed the guideline to 612 or better. And these are some data, again, in the Commission report, which bring together data from lots of different reports to give you a sense of what proportion of surgeries are achieving a good 618 or better outcome. Third indicator, almost at ECSC now, is the cataract surgical coverage. Considering a population of the whole region of Uganda, it's considered to be the proportion of that population who received cataract surgery of those who have an ocular cataract. And overall, someone who's got a cataract above that threshold level of vision that were considered necessary to operate. So it's kind of an intervention coverage indicator. And threshold is quite an important concept to get our minds around. So thresholds like these doorways in China can be different heights, can't they? So there's a really high stone on the top there, and a low one, that wooden red one. And it's it's how bad does the vision need to be before you move ahead to operate, okay? And in different countries, there will possibly be different levels of threshold. But this is important when you're considering the population needs, so it's country and context specific. WHO currently is requesting that countries report what they would choose to use as a standard threshold, and in addition to that, if it's not 612, 612, report more than 612 numbers as well. So that's threshold. But the final indicator, which is really the focus of this topic, this talk, is an effective cataract surgical coverage, which is ECSC. I'll just simply refer to it as ECSC going forward, just as you said. And this is the people in the population who achieve 6 or better after their cataract surgery. Okay? 6 or better. And a portion of everyone who has an old cataract or previously operating cataract. So in terms of definitions, if you're interested in looking at those specifically saying that, there was a report in 2021 which updated guidelines around these indicators. And one of the big pushes was the target for a good outcome is now 612 or better after cataract, having previously 618 or better. In 2021, the World Health Assembly met and resolution was one around vision and eye health, and specifically it introduced these 2 new indicators: effective refractive error coverage and effective cataract surgical coverage. And so targets aspiration for what could be achieved by the year 2030, so back in 2021. By the year 2030 for cataract, the recommendation is to aim for a 30% increase in cataract surgery. So that means that if back in 2020 your country was 20% effective cataract surgery, 10 years later, operation is 50%, so a 30% rise. If you were at 70%, to aim for effectively use, clearly cataract is going to end up with 6-fold better result. So 1% is impossible, but that's down to achieving. What's really exciting now for us as an eye health sector is that there's increasing notice being taken of these sorts of indicators, and they're not included in universal coverage. And they might get into sustainable development in health, but certainly there's a lot more note being taken of them, both national and international authorities. Back in 2022, pulled together data from raptors, which are, I'm sure many even maybe helping to conduct, which is a patient-based study. There's association, lots of different eye health indicators, including cataract coverage, surgical coverage, and effective cataract surgery. So this is the baseline. So 21 World Health set those targets, 2022 this is 55 countries, so it's not even half the countries. And in this map, the colours refer to how old data is. In terms of Uganda, I think that was somewhere between 2011 and 2015. So this is a figure from that paper, just to orientate you on the left. I know it's too small to see, don't worry about that, but just to get interested, I'm going to show you an enlarged bit. Is each row is a country, okay? And the red dot is the cataract surgical outcome, but it is the proportion of people that need cataract surgery who have received cataract surgery. And the blue dot, you can see in all of them, it is to the left, so it is lower than the cataract surgical coverage, is the effective cataract surgical coverage, determined by a population survey. Those who are cataract untreated or previously had surgical coverage. And you can see the range of effective cataract surgical coverage goes from a very low 3.8% up to 70, almost taking a 6-18 or worse threshold intervening for cataract surgery. All together with the screen. Okay, so this is a kind of a blow up of that area. You can see red dots, cataract surgical coverage, blue dots, effective cataract surgical coverage. The gap between the two, blue dot and the red dot, is called the relative quality gap. Okay? And that ranged across all these countries between 10% and 73%. What this means is the gap between effective cataract coverage, which gives you a section of people who are not in good outcome, is defined as 18 or better. Okay, so the bigger the greater the need to address qualities and fracture, or as a population survey, it could be many years later, so there could be posterior capsular calcification, for example, that needs to be addressed. There's all sorts of reasons why the vision may not be reaching 6-18 or better. But that gap gives you a sense of, what's potentially possible to improving the vision. This is a bit more complicated to get our heads around. So we talked a bit about thresholds in terms of the cataract surgical threshold. which you might say in your context, this is the level at which we want to operate. And so the darker colour at the top on the right is a fraction of 3 over 6, that's blind. So this is the blindness. So this gives you a sense of what the coverage is amongst people who are blind. Okay? The yellow on the far left is worse than 6 to 12. So if you consider everybody who's cataract who's worse than 6 to 12 meets your recommendations for surgery, that's and it's a 6 to 12 outcome. So you can kind of get a sense of, as a threshold of where you intervene in the program, how it reduces your coverage. Just to show you this a close up, you see, I've just here, and you can see that purpley dot blindness of 6 to 12, the level at which you would operate. Okay, so fast forwarding to this year, 2025. This is the latest data that's available. Now, for some of these countries, it's the same data as a few years ago because there's no new data. But you can see we've got some more countries that need data available. Objective is remembering those set the ILT to raise the 2020 essential points. These are the ones, okay? Because the Europe version, you've got data actually, population citizens could model out in Europe. In the African context, you can see top left, the lines are going up, but not really going up fast enough to really hit the aspiration we have vision in the population. Yeah. So that's then we need to drive up coverage. And kind of linked to that is also improving access and equitable access within that context. Just before I go into Vietnam, this is perhaps the most useful data. They've got around some graphs. You can see this down on the left, 2000. And you see the blue is a cataract surgical coverage and the effect is cataract surgical coverage. And you can kind of see that over time they have been able to increase those indicators. There's still quite a gap, quality between the green and the blue. The trend is going up. First big jump really the use of increasing use of lenses around 25 years ago. It was really in the early 2000s that Vietnam started to stand. And they've gone on to increase. This just shows not having data to really form your program decision making, whether it's regional or national. And it's encouraging to encourage us, it shows that things can change, they can really improve. So I want to just talk briefly about advancing access to equity as part of the ECSC response. So I'll access quality flat on the right, quality flat. There are lots of different aspects. One of these is equity, and part of the work of the Commission was a Delphi, that's an international kind of collaboration to think about strategies to improve equitable access to cataract services. And this is a really difficult review, but let me walk you through it and hopefully you can that. So on the top are regions, okay? On the far right is global summary. The second one on the right is sub-Saharan, and there are various other regions. And the downside, each row is just in this logic process, and there's looking into this more, the paper bottom really available. So these are kind of the priority on who's in greatest need. Just to illustrate this, to bring this to life, this is data from Nigeria, based on National Eye Health Survey. This was done some years, 15 years ago. And this is looking at the prevalence of cataract blindness in the population. I think it was 40 years and above, the survey, looking at the prevalence of cataract blindness and asking the question, when you disaggregate that data, which groups have the greatest prevalence and relative size?